In this consultation, Mrs. Miller is attending the doctor about her blood pressure. The doctor is concerned about her high blood pressure and sees from the computer record that she has not been ordering her medicines. She has also been missing appointments, which alerts the doctor to the possibility that Mrs. Miller has problems with her memory. In this case, Teach Back can be a very useful technique to assess patients' understanding and recall. With the increasing numbers of people with dementia, this type of scenario is set to become very familiar to us all within our own families and in our workplaces.
There we go. So it is a bit up, your blood pressure, Mrs. Miller.
I don't understand that, my dear. Why would it be up? I feel fine.
Well, looking at the computer, I don't think you've had any of your tablets for your blood pressure for quite a while. Last time you ordered them was way back in March.
No, I don't have blood tablets for my blood pressure.
And I was a wee bit concerned because you've missed the appointment last week and we had to phone you to come in this morning to make sure you came for the appointment.
The girl at the desk, she phoned me in this morning. No, I didn't miss an appointment. I don't have an appointment. I'm fine. I'm just fine. I don't take tablets, no.
You're on the computer for them. I was just wondering if you'd been having any trouble with your memory recently. Has anyone said anything to you about that at home?
Only my daughter, she keeps on at the time. She keeps telling, oh, Mum, you don't seem to remember things, she says.
And have you noticed that yourself a bit?
Just a bit. It's just like, you know, I found myself down at the shops and I just can't quite remember why I was there.
Oh.
You know, and I'm going down really purposefully. And then I can't remember and I'm looking at all the shelves and I just don't know what it was I had on my mind.
No, has that happened a few times?
Yeah, 2 or 3.
2 or 3?
Yeah.
And has that been a bit worrying for you?
I mean, you know, you sort of think, am I going out of my head or something like that, you know? I mean,
yeah, so a little bit preying on your mind.
Yeah, I think it is, because I was, I put the gas on the other day. Sally, she came in and she said, what are you cooking, Mum? And I said, I'm not cooking. She said, well, the gas is on.
Oh, right, so you left it on with nothing on the stove.
I suppose I must have done.
So I think it's good that we're talking about your memory, and the reason for that is that there's actually a lot nowadays that we can do if someone's starting to have some problems with their memory.
Oh, Doctor, I don't want to have problems. You know what? I remember my grandmother. She went doolally, she did. And I mean, you couldn't have a conversation with her at all. I wouldn't want that.
Did she? Well, that sort of thing's very worrying. But nowadays, there's things that we can do to help with your memory, and particularly if we pick it up early. So I was going to suggest to you that as well as getting you back onto your blood pressure tablets,
you keep on about the blood. I don't take blood pressure tablets.
You are prescribed them and your blood pressure's up, and I think it's up because you've not been taking them. So I think we should get you back onto them, and there's things we can do to help you remember to take them, so we'll talk about that.
Right.
But if you were agreeable, I think we should start to do some tests for you for your memory, and if it shows that you are starting to have some problems, then there's things that we can do to help that. But if we leave it too late, they won't work as well. So my suggestion would be is that we should start to do that today, get you to have some blood tests, and I'm going to arrange for you to come back for a funny memory test that we do here.
You want me to have some tests?
A blood test with the nurse today, and I'm going to book you an appointment to come back to me to do a memory test.
What's that involve?
Just some questions. Just some questions.
So I'm going to do some tests?
Yeah. We'll get you to have a blood test today and I'll book you an appointment. I'll write all this down for you so that we're clear. I'm going to give you your prescription for the blood pressure tablets. What's your daughter called again? I've forgotten her name.
Sally.
Sally, that's right.
Sally.
I've got a phone number for her here, and I was wondering how you would feel about if we got Sally to remind you about the appointment next week.
She's always going on about things already. don't know if I want her to. I mean, it's a bit of a private thing, this, isn't it?
Okay, if you don't want her to be involved, then we don't have to do that. Are you all right with the receptionist phoning you up to remind you?
Sorry, what?
The receptionist giving you a ring next week
girl at
before
the
the
desk.
appointment, like she did this
Yeah.
morning.
Yeah, that's fine.
Would that be all right?
That's fine, yeah, that's fine.
So the blood tests that I'm doing today are to look for things that can affect your memory. Because sometimes if you have something like an underactive thyroid gland, or if you're short of some vitamins, that can affect your memory. So if we pick that up, we can do something about that.
My father, he had an underactive thyroid.
Right.
Oh, he got so slow, you know, everybody thought he'd been drinking. It was dreadful.
Well, it can run in families, so I think it's important that we check that. I'll see you back to do the memory test.
Right.
If that does show that your memory is not as good as it used to be, I'm going to be asking you if I can make a referral to a special memory clinic, which is designed to help people with their memory.
Doctor, I don't want to be seeing lots of doctors. I'm fine. I mean, you know, getting down to the shops and forgetting why I'm there, it's not that important, surely.
The reason I'm suggesting it is that if you are starting to have a problem with your memory, it's much better that we do something about it really early now than leaving it till it gets worse.
I suppose you're right. I don't want to become a silly old woman who doesn't know what she's doing.
No, you're not becoming that. You're not becoming that. And there's lots we can do to help with the memory nowadays, and that's why we don't want to leave it. We want to do something about it now.
Right,
If it is,
right.
and it's starting to cause you some problems from what you're saying.
Well, I was a bit worried with the something I left on, and my daughter, she was very cross with me.
Okay. Well, I won't phone your daughter because you don't want me to do that.
No,
But I will see you back next week
next week for some tests.
for some tests. And we're doing some blood tests today. We're just going to go down to see the nurse for that just now.
All right.
For the medication for your blood pressure, one possibility is I could ask the chemist to put it in a box for you that has the tablets for each day in a separate day. And then you'll know whether you've taken the tablets for that day or not.
Can Sally go and get the pills? Can she?
She could do, yeah, if you don't mind me speaking to her about that. Just about the blood pressure
No,
tablets.
no, she knows. She knows.
I think she does know because I've spoken to her about it in the past when she came with you about you being on blood pressure tablets.
But I don't remember being on blood pressure tablets.
You've not had them for a while, so
No.
that's maybe why you don't remember. But I think
Right.
we should get you started on them because your blood pressure's a bit up.
Right, it's up.
Yeah.
And that's important,
Yeah.
is it? All right.
So we're going to go out to reception. I'm going to write down the appointment for next week, but I'm also going to phone you about that.
Right,
I'm going to write down the names of your blood pressure tablets for you.
right.
And next week we'll get an arrangement with the chemist for him to give you it out in this special box, and I'll show you that next week when you
Right.
come.
Right.
Now, I've said a lot to you today. What do you think are the most important things that I've said to you today, just so that I can make sure I've been clear?
Tests. You want to do some tests.
Do some tests. And why are we doing the tests?
Because because I forget things.
And because we can help with that. Because we can help with that. If there is a problem, because we can help.
Right. So it won't be downhill all the way.
We want to get in early so we can stop you getting worse if we can.
Yeah, I don't want to get...
But certainly help you out with it.
Right, doctor. Right.
Anything else you'd like to ask me?
No, we're going to have some tests.
Yeah, let's go and see the nurse and we'll make the appointment for next week at the front desk, and I'll write down for you the names of the blood pressure tablets and when you're going to come back.
All right.
Let's go and see the nurse.
Right. Okay.
No, don't. That's great. Just down the corridor there.